All right, and welcome back. It is time to jump into our social hour. This is K24 this morning, and my name is Shiko Kaitani. Remember, you can catch us on our social media platforms as at K24 TV on Instagram, Facebook, and Twitter. Now, with more than 4,200 people dead from the coronavirus, according to reports around the world, and with more than 113,000 cases confirmed by the World Health Organization, health officials and governments are struggling to not only contain but prevent the spread of the disease. We're actually dealing with a mass panic at the moment, and who wouldn't be worried? In fact, the head of WHO has stated that this really is a pandemic that we are dealing with. So with so much information out there spreading faster than the virus, how do we know what's what? Well, let's answer that for you today as we understand the basics about coronavirus, bust a few myths, and of course talk about preventative measures we should all take. I want to welcome to the studio Dr. Wilfred Marube, who is the president of the Public Relations Society of Kenya. Karibu sana.
Thank you, Shiko. Good morning, viewers.
Good morning. And then we've got Dr. Paul Yonga, who is an infectious disease specialist with us today.
Thank you for having me.
All right. So, like I said, let's start off with basics because, of course, people are quite confused. And let me start off with you, Dr. Yonga, on, just pretty much how the coronavirus does affect the body and actually how it goes about killing someone.
So, thank you so much for having me. So, coronavirus is it's a really large group of viruses which have been known to actually jump from the bat family.
Yeah.
However, we have three common coronaviruses that are known to actually infect humans. So we have the SARS coronavirus that emanated in 2003 from China, and then we have the MERS coronavirus that started in 2012. Actually, it's still ongoing in much of the Middle East, most predominantly in Saudi Arabia, and then now we have SARS-CoV-2, which is responsible for COVID. So it's really a respiratory illness, which is when you compare the severity, it's much less than the previous two, but it's much more contagious.
Okay, so hence why we're seeing it now getting to such levels.
Exactly, yes.
All right. In your opinion, Dr. Marube, what do you think has been the biggest challenge, for example, our government or the Ministry of Health, in relaying this information clearly, concisely to the people of Kenya?
I think the points people of Kenya are concerned with their health status.
Yeah.
So it's a question of public trust and public confidence. That's one of the challenges that government, through the Ministry of Health, probably has not been able to be fast enough and maybe loud enough so that it's able to instill confidence and trust in the health system by the Kenyan people.
Yeah.
From my point of view, government might be prepared. But you see, when you're talking about such a pandemic, not about preparedness. The question is about how do people see you being prepared? Yeah. So government might be very prepared, but been unable to transfer that preparedness in terms of showing how prepared they are. And the best way to do that is through communication. So I don't think government has communicated enough on its preparedness. Probably they are very prepared, but it's not about the technical ministry officials need to be prepared. It's about Kenyans. Kenyans need to see government prepared.
Right.
But I think for the last few days we've seen government upping up its communication. But much more needs to be done. I think that is the first starting point. Okay. The level of preparedness. All right. Government needs to instill public confidence on its level of preparedness. All right.
Let's rope in our audience at this particular time, gentlemen. We do have a question of the day for you as far as our topic is concerned. We're asking, what information have you had about the coronavirus that sounds misleading to you? What information have you had about coronavirus that sounds misleading to you? At K24 TV on Instagram, Facebook, and Twitter. Of course, if you'd like to send in a WhatsApp message, you can see that number that's at the bottom of your screen. And of course, if you want to call in and talk to the experts this morning, why don't you? We'd love to hear your voice. At this particular point, I would like to welcome Dr. Philip Ngere. Good morning.
Morning to you.
He is a medical epidemiologist from the Ministry of Health. So we do have government represented here on set. Dr. Philip, we were actually just talking to, or at least I was just engaging Dr. Wilfred about why we have had such a challenge or communication breakdown from MOH to the people of Kenya to fully understand, you know, and get a full scope about what the coronavirus is. Can you tell us?
Thank you. Sorry for coming late because of circumstances beyond me. My name, just like you said, is Philip Ngere. I work with the Ministry of Health. Division of Disease Surveillance and Response. I'm a medical epidemiologist. To your question, I think one thing that we need to understand is that coronavirus, the particular coronavirus that we're talking about now is new. Not a lot of things are documented about it. And every time communication needs to be passed on, then you need to gather information that is available on the same, prepare it and package it for specific audiences. And considering the fact that it's also evolving, things are coming up pretty fast, and it's taken quite a while to package this information in readiness for dissemination to respective audiences. That might have been because of the delay.
There's that word that you've used, new, and that's what's actually popping up in terms of the reports. Now they're referring to it as the new coronavirus. What do you mean by new?
New means it is what we call in our technical term emerging. It has not been there before, at least in humans. It's not been there before, and it's recently been discovered in humans. So it is not something that has been documented, investigated, researched, and facts about it are ready on the shelves so that in the event that there's a case in the country, you can literally go and lift from the shelf the facts and share with the public.
Dr. Yonga, you know, once it had actually broken out and, you know, sources were indicating that the coronavirus, the outbreak most likely started with bats. In fact, there was that picture of the woman enjoying her bat soup and people saying, oh, it probably started from that market in Wuhan. Are you now saying for sure this is the source of where this new coronavirus has emerged from?
At the moment, no. We are not very sure where the actual source comes from. Because you find that a lot of these coronaviruses, even the previous two, actually have their source from bats, but transmitted through animals. So like the SARS coronavirus was transmitted through the civet cats. When you come to the MERS coronavirus, it's transmitted through the dromedary camels. But for SARS-CoV-2, we are still not very sure where it emanates from, so we cannot really say with authority where it really originates from. But at least what we can be sure of is that it actually originates from the bats. But how it is transmitted from the bats, the actual animal transmitting it is what we are not sure of at the moment.
Okay. As a public relations specialist or officer, so to speak, Dr. Wilfred, what is so worrying about the information out there that you, even as an organization, as PRSK, had to just speak up?
I think for us, number one is that there's too much silence. And as you said, with the power of social media, there are all sources of information. So when the authorities or the credible sources on health issues in the country are a bit slow, a bit quiet, then it means that there is an opportunity or there's a gap for either misinformation or either unverified information or either very imaginative people come up with information on social media and then start sharing it as maybe tips on how to probably handle coronavirus. So I think for me that is where part of the challenge is. A bit of silence or a bit of slow speed. Because we live in a digital space where things are very fast. So the idea is, and I think there's need for Ministry of Health, just as Dr. Ngere has said, to separate the technical knowledge and from the general information. The public may not be really interested on what is happening in terms of treatment and everything at this point. They just want to know the first point. How prepared is our health system? So I think that's information that could be repeated regularly. Research shows that the same piece of information needs to be repeated about 7 times before people believe it and start remembering it. But just either having one press statement on an issue, having one tweet, and then you forget about it. But what about other people who are outside Twitter? What about community radio? What about people in social gatherings? So there need to be multiple channels of communication. So when you get that, number one, there's a bit of slow speed, there's a bit of silence. There's only a single channel of communication. And there are many other players like media, like roping in the media. And I'm glad that in today's paper, we've seen there is a coronavirus update by the business, by the people daily, which probably should be happening on a daily basis.
So yes, and when we're talking about every day, that's just the paper. But when we talk about electronic media specifically, it should be frequent.
Should be very frequent, and there should be one dominant voice. You're having too many voices, even from too many experts talking about it. So we need to have unity, or what should I say, we should have a singular message being passed on. So, and I think it's a challenge for the Minister of Health to create that messaging framework. So that whoever talks to it, whether other stakeholders from the medical field and everywhere else, they plug into that particular framework on messaging. I think that's where the challenge is.
All right. Let's talk a little bit about transmission, Dr. Philip. How easily can the virus spread? Because these are now just the basics. We're laying the basic work here. So things that people need to understand. And by the way, very importantly, what could we be doing wrong that we are completely unaware of that puts us at risk?
Thank you. First and foremost, we need to understand this is a respiratory condition. And when you talk about transmission, then you're talking about pathogens being exiting through our respiratory system. So when we breathe, when we cough, when we sneeze, then if you're infected, then most likely we'll be spraying out the pathogens. When we talk like I'm talking now, there's a likelihood that I would be spraying the pathogens. And what is documented is that this pathogen, when it comes out, then it's transmitted through droplets. Droplets are small particles, though not too small. They are wet and heavy. So when I sneeze and spray the droplets, then they can travel probably 1 or 1.5 meters from where I am. When I cough, when I talk, and I'm infected, then that happens. So it means then anybody standing within my vicinity, at least a meter and a meter and a half from me, is likely to be infected. However, one thing that we need to note is that when these droplets settle, they don't go far, but they settle on surfaces. So I'm here in your studio today. If I'm infected, I'll be talking, I'll be spraying it, I'll leave something on the table, I'll leave and go. But anybody who touches that table after I've left is likely to be infected. So then it means, as much as I might be keen to avoid somebody who is coughing, somebody who is sneezing, we should also be very conscious of our environments. When you get into a vehicle, when you get into a meeting hall, when you get to where people usually visit, and you touch the door handles, we need to make sure that we clean our hands, that we don't transmit it to ourselves through contact. We need to make sure that we don't touch our faces, we don't touch our mouths, we don't touch our eyes with hands that are dirty, because then we are likely to pick up and transmit to ourselves, even in the absence of somebody actively spraying the pathogens.
A very good point you've actually raised there. Dr. Yonga, speaking about now, of course, transmission, of course, you're seeing a lot of people talking about, okay, fine, yes, I need to sanitize myself, I need to wash my hands. So there's a lot of that we'll even get into in just a few. But when you're told self-quarantine, what does that mean? When you simply tell someone, okay, and the government has even advised, please, kindly stay away. What should someone be doing? How should someone go about that?
So first of all, that should be very contextualized to the particular setting you're in. For example, self-quarantine is where the government actually tells you you're someone who probably has been to an area at high risk of transmission, but you yourself do not have any symptoms. So the government may tell you, please go lock yourself in your house for about 14 days. When you're in your house, please make sure that if you're living with someone, do not share towels. If you're using a single toilet, make sure that you use the toilet last and make sure you clean thoroughly. Make sure you wash your own utensils. Make sure that pretty much everything that you do, you make sure that you're completely separate from the other person in the house. So in some settings, especially in the developed world, that may be very feasible, where people may actually be told just stay indoors for 14 days, and even in Nairobi for people who are bachelors, people who are bachelorettes.
Yes.
But in a family setting, that may be a bit tricky because you find that if there's so many communal, if you're using so many communal facilities like the kitchen, the bathroom, that may become a bit tricky in imposing such self-quarantine issues. So that's why in such a situation, you really need to be very clear on which people can qualify for self-quarantine. I know for Public Health England, there are certain criteria you have to meet. If either of them you can't meet, you definitely do not qualify for self-quarantine. For the Ministry of Health, I do not know which quarantine policy they have in place. Right. Because those are some of the things that should come out clearly.
Maybe you can jump in on that one, Dr. Philip, and answer a little bit when we talk about quarantine.
Thank you. Yeah. I think we need to begin from the, we need to understand from the beginning what is quarantine and why is it being undertaken. Quarantine literally means separating people who are likely to have been exposed, like Dr. Yonga puts it, from the rest of the public for a period of time. And we monitor them in the course of that period to see if at all they turn out to be with the disease or not, in which case then we go back to the public. There are two forms of quarantine. We have supervised quarantine and we have self-quarantine. You know, here we're only talking about self-quarantine, but we also have supervised quarantine. In settings that are developed, in settings that are dealing with few numbers, they're able to manage supervised quarantine very easily. Supervised quarantine means you keep me somewhere, make sure that you manage my amenity requirements, you manage my food requirements for the period that is, meanwhile you monitor me as you keep me there. Right. Self-quarantine means I empower you with information. Okay. I give you the do's and don'ts. I tell you what is expected of you, what you need to do, just like Dr. Yonga puts it, and what you don't need to do so that you don't jeopardize the lives of the people you stay with or the other lives of the people that you live in close proximity with. So, in our context, what is feasible is self-quarantine. Because we don't have structures that have been set aside to accommodate supervised quarantine. So in our self-quarantine, when we get these travelers that have come from countries that are reporting outbreaks, or if we have contacts who people who've made contacts with where cases have been, people who've been confirmed to be having the disease, then we advise them on what to do, why it needs to be done, and for how long it needs to be done. So that we make sure that the rest of the public is safe.
I think now the question that will come in is who enforces it, because you know in some jurisdictions people say rules are made to be broken. Right. So supposing that quarantine, supposing these individuals
there's no one there to supervise,
that actually breaks the quarantine. Who is held accountable
on that particular case? Okay, one second, Dr. Wilfred. Let me just let our audiences know that they can actually call in if you'd like to speak to us. Yes, there you go. The numbers are at the bottom of your screen. That's WhatsApp. And of course, if you do want to call in and ask a question as far as the coronavirus is concerned, why don't you talk to the experts this morning? Because we're here to actually clear the air, literally speaking. Yes, what do you want to add on to that?
I think Dr. Angela raises a very serious issue. And I think that's where the issue of communication and the assurance to the public. The question is, how does the Ministry of Health assure the public that self-quarantine works? Because we are relying on ethical behavior, we are relying on good intentions, and we are relying that the person who has been requested to be self-quarantined are going to be cooperative. Right. Then the question is, how does the public get that assurance? I think it also points down to communication.
I know, we've seen that in Japan. There's a gentleman who was actually diagnosed with it and decided to go out and spread it around the town because he felt like, I'm not going to die alone in this. So this is the thing that we're saying. Like, if someone wants to break the rules, then what?
So I think I don't know whether the Ministry of Health has some sanctions. And probably because you're talking about now, you're talking about the state of public health. And you're talking about members of the public. The question is, how do you provide assurance to them that self-quarantine works? Probably it works. And I think it is a challenge the ministry to step up and probably the media would be very interested and other ways of documentation so that you show Kenyans how self-quarantine works and probably having, of course, we understand there's confidentiality of who have been asked to self-quarantine, but also getting to hear their voices. What do they think about it? I think that's the kind of assurance that the public requires.
Yes, Dr. Philip, because I can see you want to say something.
I think I want to let the public know that the concept of self-quarantine is not new with coronavirus. We practice self-quarantine routinely. When you were diagnosed with MDR TB, you're put on self-quarantine. And you are followed up, you're monitored. It is not a new concept totally. And the Public Health Act provides us with a basis of taking action on you if you're in breach of self-quarantine. The people we've self-quarantined now, we follow them daily. We follow, the moment we get to note that you're in breach of the do's and don'ts.
What happens?
The law allows us to pick you up and isolate you. That is even a worse situation. Nobody wants to be isolated. You'd rather comply and stay in self-quarantine. So there's nothing to worry about. Self-quarantine is not new. It's something we do every day in medical practice. And the Public Health Act allows us to get hold of you if you're in breach, if you're endangering the lives of the public. Like if you're with MDR and we find you walking on the street without a mask, we are supposed to get a hold of you and take you into isolation. So things are in
order.
Things are in order. You don't need to worry.
Well, of course, if you are following the news, Kenya launched a 120-bed isolation center Friday dedicated to the coronavirus cases in case of an outbreak in the East Africa region. But the first of its kind, by the way, this is at Bagazi Hospital. And our very own Health Minister, Mutahi Kagwe, emphasized that the country is ready to deal with any outbreak of the virus. In fact, he goes on to say that about 1,100 health workers have been trained and additional health workers have been deployed at JKIA, and this is supposed to cascade down to the community level throughout the country. Now, you know, you wonder, by the way, Daktari, when we talk about preparedness and how ready we are, it seems like everything seems to be okay in the city center, but your thoughts in, you know, especially the entry points, you know, the border points, what happens to our Mombasas, our Malabas? Do you feel that we are ready for that before even I take Dr. Philip's take on that?
Yeah, according to the information I'm privy to, I think the ministry isolated sort of 14 high-priority counties, Nairobi being one of them, and then other counties that either are near ports of entry or are actually at the ports of entry. Now, for places like Nairobi, Mombasa, Kisumu, and Eldoret...
Do you feel that,
for Nairobi, I think they have really tried. I think for Nairobi, they have really tried. I may not be very sure about what's going on in other places, because, you know, when you're managing, especially when you're managing someone who comes in with very severe respiratory disease, it's not only about managing the respiratory function. There are other organs you need to look at. You need to check how the bloods are. You need to check how the kidneys are functioning. You need to check how the liver is functioning. So you might find that these facilities are set up, but the ancillary issues to check this, how these organs are working, and even the specialists to actually undertake this. Because most of these specialists, the 4 counties that I've mentioned, they may not be many, but they have at least some of these specialists. Some of the other counties I may not be very sure.
All right. And that's what we actually want to ask Dr. Philip to take up when we get back from a commercial break. We are talking about demystifying the coronavirus this morning, and of course, any questions that you may have to ask our specialists, even as far as the communication from the Ministry of Health is concerned. What's your take? Do you feel that they're doing a sufficient job? Well, also Dr. Wilfred is also here to challenge that, and of course, Dr. Paul Yonga, infectious disease specialist, here with us to even explain more about the basics on coronavirus. Keep talking to us. Our social media platforms are at K24 TV on Instagram, Facebook, and Twitter. If you want to SMS us, 21222 is that SMS number, and of course, WhatsApp is active. We'll be taking a look at your feedback in just a few.